Ectopic pregnancy. The fact is, approximately 2% of all pregnancies are ectopic pregnancies. What do we mean by an ectopic pregnancy? Any pregnancy that occurs outside of the main cavity of the uterus is an ectopic pregnancy. An ectopic pregnancy normally do not grow to term. There must be a quick and urgent evaluation and treatment. Usually, when you have a fertilized egg, it travels from the fallopian tube to the uterus and becomes implanted in the main cavity of the uterus. But in ectopic pregnancy, this does not occur. Let me tell you that we have different areas of the body where an ectopic pregnancy can grow. The first one, which is most common, is in the fallopian tube. When you have a fertilized egg in the fallopian tube, which continues to grow without onward movement to the cavity of the uterus, it is called a tuber pregnancy. It can also happen in the ovary. Other areas where we can see an ectopic pregnancy is in the abdominal cavity. Another area where an ectopic pregnancy can be found is in the cervix. Cervix is that area that connects the uterus to the vagina. So we could also have an ectopic pregnancy in the cervix. Let's talk about the tuber pregnancy, which is the most common one. As the ectopic pregnancy continues to grow in the fallopian tubes, this pregnancy expands and increases in size, and this could cause the fallopian tube to burst, and this will lead to hemorrhage. Blood will be escaping into the abdominal cavity, and this could lead to death of the pregnant mother if urgent treatment is not given. What are the symptoms of an ectopic pregnancy? At the early stage of an ectopic pregnancy, there could be no symptoms. You're not going to feel anything. And some people are so sensitive, they might feel that something is wrong, maybe a little pain. But as it progresses, there is an increase in the pain sensation coming from that area of the body. Another thing that a pregnant lady could notice is bleeding from the vagina. Another symptom is pain coming from the pelvic area, and usually this pain are more severe than menstrual pain. Now, how do we diagnose an ectopic pregnancy? The first thing to do to diagnose an ectopic pregnancy is to first check if the lady is pregnant or not. So you take blood sample and you check the HCG level, human chorionic gonadotrophin. So this is pregnancy indicator, or you call it a pregnancy hormone. So you check this hormone in the blood. When you see the rise in the level, then you say the lady is pregnant. Now you want to do an ultrasound to locate this pregnancy and to know why this lady is having this severe pain. Then you scan the uterus, you see there's nothing in the uterus. Then you want to see where this is growing. And we might find this ectopic pregnancy lodged somewhere in the reproductive tract. How do we treat an ectopic pregnancy? If the pregnancy is unruptured, then we could give intramuscular injections to help in terminating the pregnancy, and the mother will be kept under close monitoring and also follow up with the physician. Another thing is a surgical intervention to remove the ectopic pregnancy, and usually the part of fallopian tube is removed to prevent recurrence of an ectopic pregnancy. Trust me, urgent surgical intervention is required for a ruptured ectopic pregnancy to save the life of the mother. Do we have any way to prevent an ectopic pregnancy? Maybe not yet. There are no specific way to prevent an ectopic pregnancy, but there are some fertility treatments that could help the mother get pregnant again. If you have any questions, clarifications, please drop them in the comment section below. Thank you for watching. See you again.